What's our goal? What's the ideal office that we can think of? What's the best case scenario that we want to create?
Welcome to AMC. I'm Dr. Greg Miller. We're in a series on office evaluation. Today we're going to cover the topic creating a culture with Dr. Tara Horrall. Let's go ahead and get started.
Anytime you're trying to create a culture in an office, essentially you want to begin with the end in mind. What's your goal for that practice in the next 2, 5, or 10 years? Now, if you're already in practice and you have an open office, again, this is for you as well. But if you're brand new and opening an office, this is something important that you're going to want to think about as you're planning, laying out, decorating, painting even, and putting together that office. So again, we want to begin with the end in mind. What's our goal? What's the ideal office that we can think of? What's the best case scenario that we want to create? And essentially that's a stress-free, referral-based, fun, profitable practice. So how do you speak those things through your office appearance? Well, first of all, what's the first method that a lot of people are going to come to your office? Some of them may drive up, right? Especially if they're being referred. They may just take a pass by the office. So, all right, first of all, if they're driving up and they drive up to your practice and there's grass growing through the cracks of the concrete and the bushes haven't been trimmed in ages, and things don't look neat and clean and tidy outside, or let's say your sign is crooked and maybe it's just the hours that you have on the outside of the glass. Maybe it says that you're only there 2 days a week for half days. Again, all of those things speak something to a potential patient, a potential referral, and will make a difference in the number of people that come into that office. So again, we have to begin with that end in mind. If we want referrals to come in, we need to pay attention to the outside. We need to make sure, again, it's neat and clean. We keep it tidied up. Things are straight. Then we get to the door, right? If the patient gets to the door, we want to make sure that door handle's firm. There are details there. Those people's innate is on all the time. And again, if they're taking a hold of a door handle that is about to come off in their hand, that speaks quality, that speaks value to those patients. So they get in the front door, right? Let's say you have those things taken care of and they get in the front door. What's the reception area like? Do they see any other people in there? Are you scheduling so that there are actually other people there whenever your patients or whenever these referrals or new patients show up? If they never see another patient in your office, they may start to feel like they're a guinea pig, right? And that's not a great feeling for a patient. You want to come into an office where other people go. It's a principle. People go where people go because people go where people go, right? And so if they don't see any other patients in your office, that doesn't give them that feeling of confidence. A lot of them are looking for, especially when going to a chiropractor, especially if they're like a lot of folks out there today who've been told, negative things about a chiropractor. You just never know. So again, we have to prepare for all kinds of patients so that we appeal to the most possible. So again, does that waiting room speak warmth? Is it inviting? Or as soon as they walk in the door, are they being sold supplements, lotions? There's nothing wrong with selling those things, pillows. But again, that front area, as soon as they walk in the door, is not when they want to feel like they're going to be sold all kinds of things as soon as they step in. Again, we want to keep that area nice and warm and inviting. Once they walk in, what's the next thing that they'll see? What's the next place we're going to create that culture? Yeah, it's your staff. How's your staff? How's their appearance, first of all? Do they come to work well kept? Are they in a clean, neat uniform? Do they have a name tag so that the patient doesn't have to guess who they are? Are they identifiable, right? As hey, I work here, I'm the person to ask questions of. And then, do they have a good attitude? Are they warm and inviting? Are they giving that patient, are they putting that patient at ease as soon as they step in the door? Or is it, well, I think you're maybe supposed to fill out this and then I'll figure out what, again, make sure that they're well trained so that that patient gets confidence from the get-go as well. From there, they're going to fill out your paperwork. Again, what does that speak about you and about your office? Is the first page that they get about finances and insurance? What does that tell people that you're most concerned about? That's your primary, right? So again, not that we don't want to ask those questions, but are they going to be the very first thing that I'm going to ask? Same thing on the phone. That's if they're not driving up to your office for the very first time and they're a walk-in schedule, they're going to have called your office. Was that staff able to take time and really pay attention to them on the phone? Or was it a rushed conversation where she was speaking really quickly and they maybe feel like, well, maybe they don't have time for me? All of these things are speaking to those patients or those potential patients every minute of every day in your office. So again, if we want to create that stress-free, referral-based, fun, profitable practice, we want to make sure and keep these things in mind. We go into your consultation room. What does it, what does it speak about referrals? Are you mentioning the fact that someone referred them? Again, does that come up? Are they understanding that you respect them? Is it serious? Do they understand that you really get their problem? Because again, they're not going to come back if they don't. What does that room speak about you? Does it say, hey, I'm a smart doctor? I'm well respected. I've studied all of these different places and I have the authority to give you health information? Or are they coming into your messy office where they sit down, there's piles of, stacks of files next to you, and, x-rays may be thrown in the corner, and those types of things? Or, again, is it neat and clean? Does it feel warm and inviting? And does it speak authority and confidence for you as a doctor? Again, as we go on through things like exam and x-ray, do we have the stage set in those areas so that they understand health as opposed to pain is our priority? Again, these are important things for your office. So again, from there, does your office speak value? If we want a profitable practice, we have to speak value. We have to talk in terms of what the value of their care is. And the actual layout and decor in the office has to speak value as well. How do we do that? Well, one example is, in front of, is it a comfortable place where they're going to have to write a check? Do they have a nice soft feeling whenever they're having to pay? Again, just one example, or where they're handing you their credit card. So again, just another example of creating value. Do they see whenever they're in your office that you have great success with a vast array of different problems, health problems? And are they getting the confidence in you that they need to have in order to refer other people into your office and to be a good patient themselves? And there's, again, oodles of ways to speak that to them. But again, hanging your success stories. Do you have other people's stories hanging in your office where new patients and other patients can, number one, know that you help other cases like theirs, and so that they know that you have a lot of patients and you treat a wide array of different problems. So again, all of these things really, really important when laying out your office and creating that culture. But just remember, first and foremost, begin with the end in mind. Are you actually setting that office up, decorating that office, and then going back through that office on a regular basis to see it with new patient eyes what that new patient, what that referral, what the referrer is seeing, so that they'll want to send other people into your office for health and hope.
Hey, my name is Rick Palma. I practice in Leeds, Alabama. And a great thing about having a system that we can use in our office, it allows us to create a culture of chiropractic, of health and wellness in our practice. And through that type of culture that we develop, it's not just about getting people in for pain or trying to get people to send in their family or their friends. It's just sticking to chiropractic, what chiropractic can do, and telling people, did you know that chiropractic can help with this condition? Or did you know that, nutritional, issues somebody can have this problem and it could be from this. And they said, well, I know somebody that has this. And it allows us to really generate a lot of those conversations without just having to do tons of external promotions or all kinds of different things just to get people in the door. We're allowed to create that health and wellness culture and those conversations where people are talking about chiropractic and they're talking about their health.
Thanks for joining us today. As a reminder, we've got regular webinars that go into even more detail on this topic. Check the description for more ways to get our content and sign up. If you'd like more information about AMC and how it might help your practice, you can always reach out to us at amcfamily.com.